Does telemental health work? Short answer, yes. I'm gonna sit this down though. Telemental health works, but how do you set yourself up for success? Hey, I'm Dr. McCleary, and I make mental health videos for veterans. Some people question whether or not telemental health or telehealth is as effective as actually coming in the office. And multiple studies have already shown that it's just as effective. And for a lot of you, that means nothing. All I can tell you is most people in my profession, including myself, would not do it if we thought otherwise. This year, 2020, has came with a host of difficulties. And one of those difficulties is access to mental health care and healthcare in general. Now, I'll agree with you that was already an issue, but a bigger issue came this year when people were more isolated. And telehealth has provided a way to where we can reach people where they are, to where we can see people where they are, sometimes in their home, sometimes in their car, hopefully never while they're driving. Telehealth is also something that the VA kind of got ahead of before some of these other healthcare organizations. The VA for years has tried to push telehealth services, whether over the phone or over video chat, and has gone as far as setting up different offices where people in rural communities or people that can't get to a VA facility readily can actually still get care. Awesome VA. Got this one right. Other organizations such as DOD, active duty folks, they weren't quite prepared to do telehealth. You know why? Because they don't really need it. In the military, you just tell somebody, hey, show up for your appointment. And that's the end of that. So the VA has been doing this for a while. Some other organizations have been doing this for a while in different types of healthcare. But for many of the patients, this stuff is new. So think of it like this. Something that's also kind of relatively new is online college. Online college, think about it as you might, is a good parallel to telemental health. And let me tell you why. It provides very similar platforms using video or phone sessions. But in order to be successful, the patient or the student has got to be a little bit more dialed in. So let me give you some tips on how to stay dialed in and how to be successful so you can actually receive the mental health treatment that you need and that you deserve. My first tip for you to set yourself up for success is finding a safe and private place to actually hold your telemental health session. This is extremely important because on my side, we spend a lot of time kind of looking at our offices and trying to make it a place that is safe and functional to conduct such difficult work. Now, this may be happening in your own home. So everybody's home is different, but finding that place can be more difficult for some than others. Now, if you got a 10-bedroom house and you just go in one of the spare bedrooms, all right, easy day. That's not most people's situation. Sure ain't mine. So finding a place in your home, or maybe even outside, to where you can talk and don't have to worry about the other things that are going on. That is going to help set the scene for a successful session. Now, this might take some tactics. If you have kids, you may have to employ somebody to watch them for that hour, for that time, because that time's about you. If you have other things going on, please don't distract yourself with those things. If you're on the phone, don't be vacuuming while you're in session. Don't be unloading the dishwasher while you're in session. This session is for you. And it may be the only time in that week that a time is set aside for you and no one else. So I encourage you to not let anybody else get part of your time. That time is precious. My second tip for you is an easy one. Be on time. If you work at a facility like I do, I see a lot of patients. So I don't have time. If you show up 15 minutes later, I can't give you an extra 15 minutes because I have to see somebody else after. So once again, protecting that time and being on time is going to be extremely important. Whenever that time is, be ready. And if that means having to be ready 5 minutes prior, that's what that means. I'm talking to veterans here. And yes, I did just knife hand you. Another side note to being on time. If you're doing a video conferencing session, then you just need to join on time. Or you can even usually join a little bit before and wait for your provider to join. When you're doing a phone session, it's a little bit different, because that means that you have to pick up the phone. Sometimes that may be coming from a blocked number, or maybe coming from a number that you don't readily recognize. But if you know that you have a session during that time, and get a phone call during that time from a number that you don't readily recognize, guess who that probably is? I myself have a personal policy. I give people 2 chances. I call them during their time, on time. They don't answer. Okay, well, I'll leave them a message. Let them know that I'll call them again in 5 to 10 minutes. 5 to 10 minutes passes by. I give them another call. This isn't everybody's policy. And it's not even a policy anybody's making me do. To me, it's just kind of common courtesy. And I know that I don't always pick up my own phone. So give people 2 chances. Make sure that you're on time and ready to do your session. And sometimes that means ready to answer your phone. Okay, so you got a private and safe place. You showed up on time. What else could there be? One last tip. Eliminate the distractions. And this is part of getting yourself prepared for that safe place to continue. Because if you're in your home, safe places in private places may vary. It may be private, for 10 minutes, or you need a whole hour. Eliminating distractions means letting people in your household know, hey, I have a doctor's appointment and I'm not going to be able to be reached unless it's an emergency in this next hour, in this next 50 minutes, in this next 30 minutes, whatever your appointment is. And I'm talking about mental health specifically, but really this is any of your doctor's appointments. Your kids aren't going to come in if you're sitting in a dentist chair. Your kids aren't going to come in and ask you what's for lunch when you're in the doctor's office, probably. Treat wherever you are just like you're in the doctor's office. And usually, if you're in the doctor's office, there's not a whole lot of distractions. There's not a lot going on. So you can actually focus on whatever your goals are. If you're in an environment that you have constant distractions going on, and it's hard to eliminate some of those, especially when you're at home, but you can do your best. And I'm not saying lock yourself in a closet or go in a bathroom, although that might actually be pretty effective. All I'm saying is try to minimize the distractions that can potentially come just for that session. And I bet you that can be done. And if you need help with it, ask your provider. Because that's what we're there for. We're there to help you. And if we need to help you get a more private and safe environment, if we need to help you navigate that, then that's exactly what your provider should be doing. Something to think about. If this video was helpful for you, please like it. Subscribe to my channel if you want to learn more about mental health. But more important than that, as always, if this video was helpful for you, that means it can probably be helpful for another veteran or another veteran's family member. So I ask that you share it with them. Because at the end of the day, that's really what all this is about. One veteran trying to help another.